trachoma. So we are looking at the signs which are associated. Signs which are associated with this trachoma. So here, firstly, there is something known as the corneal signs, and next there is also something known as the conjunctival signs. So now we are just focusing on the corneal signs. So in corneal signs, it includes the superficial keratitis. Next, it also includes the follicles. The follicles are present in the limbal area. Next, we look at the pannus. Pannus. Pannus is nothing but it is a superior limbus. Next, what are the other corneal signs? So the other corneal signs, it can include the corneal ulcer, can also include the Herbert's pits, and this is near the limbal area. Next, the other corneal signs, it can also include the corneal opacity. Now we have just seen the corneal signs. Next, we are looking at the conjunctival signs. So in case of conjunctival signs, it includes, there is congestion. The congestion it includes, there is something known as on the upper tarsal. Next, there is also in the fornix. Then in the conjunctival signs, there is also the follicles. If you see the follicles, it contains the Leber cells, and this is on the histopathology. Leber cells on the histopathology, and on as well as on the upper tarsal as well as the fornix. Next conjunctival sign, it includes the papillary hyperplasia. Next, there is also the Als line. Als line is nothing but it is linear scarring. The linear scarring in the sulcus subtarsalis. Linear scarring in the sulcus subtarsalis. Then there is something known as the concretions. In case of concretions, there is something known as the inspissated mucus, as well as there is the dead epithelial cells, and this is present in the glands of Henle. The glands of Henle.